Good morning and happy Saturday. This is Dr. Dumestri. Just finished up at the hospital, sending my 2 patients home. And before I get on to enjoy the rest of this gorgeous Austin day, figured I would just address this question quickly. So when we're talking about scar revision surgery after complications, there are a few considerations. So one, what was the complication? What were the conditions of this poor scar formation? So did you have an infection? Was there delayed wound healing? Or did everything actually go fairly decently and you just ended up with thick scars? So I am always more inclined to do a scar revision surgery if there has been a poor condition of healing initially, meaning that I can do something differently this time to correct the scar. Second consideration is time. So often with scar revision surgery, patients are understandably very keen to get this corrected as quick as possible so they can get back to their life, get moving, and carry on. But really time is on our side and is really important when we are discussing scar revision surgery. So at the time of your scar revision, you want the scar to be supple, meaning it actually feels soft. It's lost a lot of that really dense thickness in it. You want the tissue around it to have lost its swelling and inflammation so that you can recruit nearby tissue to then close off whatever kind of scar defect there is, and allow for complete scar excision. Now, scar revision surgery really depends also on the location of the scar. So say on your breast, you've got a horrible scar kind of around the areola, around the bottom there, then we can treat it as a lift, do a little design, and with a lift technique, cinch it all in. If it's on the belly, then the hope is if you had kind of some skin loss, for example, hopefully you have enough loose skin that we can kind of recruit some of that, actually physically remove that thick band of scar, and then close it straight up. And then as far as technique for scar revision surgery, just making sure it's really meticulous from a surgical standpoint, doing each layer individually, and then post-op scar care would be really important. Your silicone strips, scar massage, and then beyond that, if you're just someone who scars poorly, like you tend to have hypertrophic or raised, really pigmented scars, then there's consideration for laser therapy, steroid injections, and kind of further treatments beyond your basic scar care. Hope that helps. Have a great weekend.